How are you?
I'm okay. You?
Me too. So,
Good.
2 minutes, okay?
Yeah. It's okay. Yeah.
You're amazing.
Oh, thank you. I just woke up. I was sleeping before, so I'm just awake.
Okay, so let's play.
How's your day been? Busy?
Yeah, busy. Little.
Mm.
Let's wait 5 minutes more.
Nice.
Hi, everyone. Oh, Stephanie, are you
Yes.
there?
Mm-hmm.
Yeah. Oh, we are waiting.
Okay, that's fine. Yeah. I'm here. I'm gonna try and log in onto my laptop so that I can go on my YouTube on my laptop instead.
Okay.
Yeah. So don't worry. I'm here.
We will wait for Stephanie.
Yeah, I'm here.
Yeah.
Okay.
So I think start maybe.
Sorry.
I think we can start.
Yeah, that's fine. I'm ready. Yeah.
Today we're gonna talk procedure. So we're gonna explain whole process to you, and we will accept your questions in the last minutes. Hopefully,
Mm-hmm.
it's gonna be informative for you. Let me introduce myself first. Okay. So this is dietitian Ebru from Clinichub bariatric team. We are three dietitians here, and we have our manager dietitian Berna, also dietitian Eda. And today I'm hosting our lovely patient Stephanie here. Okay, thanks for your time, Stephanie. I'm so glad that we have you here today.
Thank
Uh,
you.
to start by introducing yourself first.
Okay, so I'm Stephanie and I'm based in the UK, Manchester to be precise. What else? What else can I say?
Yeah. Oh, when you get the surgery, you can tell this.
I had my surgery on the 12th of December, it was. Yeah, it was a Tuesday. But prior to that, I remember that I reached out to the team probably around September, October time.
Oh,
But yeah, and I didn't like finalize everything until I think probably November, because that's when I chose like the date, and I had like more information from my coordinator, and my coordinator, she was very like nice as well. Anytime that I have like extra question, I'll message her and she was always reply on time, always. So she was very like lovely. So when I was happy with the decision, and I had to speak with my partner as well because I had to like convince because he was a bit scared, so I had to like try and like convince him basically. So once we finalized everything, I went on and I paid my deposit, and after my deposit was paid, I secure my place basically. And I remember my coordinator like gave me like the date, you know, And from then, yeah, I chose obviously December the 12th because that was easier for me. And yeah, and I booked. Yeah, I was very excited, but yeah, a bit scared, but happy. Yeah.
Yeah, that's great. So it's been 2 months since you got the surgery.
Mhm.
This is only the beginning, actually. But would you like to tell us how it's been so far? How are you feeling?
Um, right now I'm feeling good. Obviously, I can tell that I've lost a lot of weight. Um I think I've lost more than 10 kg. Yeah,
Yeah.
because I weighed myself and I'm like now 74 kg. And bear in mind that before I even went on the diet, I mean the pre-op diet, I think I was 80. Hold on. I might have
Yeah, it was
I was
87.
80. Yeah, yeah. I was 88 or 87. Then my pre-op diet was, I think mine was for 3 days.
Mm-hmm.
And within those 3 days, um I was sent, like different diet that I can follow, food I can eat. So I was having yogurt and the jelly. That's the only thing I was having, and water basically. And it was tough, but at the end of the day, I said to myself that this is what I chose. So if I want to make a change in my life, I had to do it. And the reason I did this is because I've got PCOS basically. I don't know
Mm-hmm.
if anyone knows PCOS here. So my hormones are a bit, like imbalanced. And one symptoms with PCOS is like weight gain. You can eat a lot, or you might not even eat a lot, but it affects, like your weight a lot basically. So yeah, so that's why, like kind of like pushed me to do this. So after the pre-op diet, I think when I flew to Turkey, on the day before my sleeve, I had to weigh myself, and I think I was 86. And I was shocked because within 3 days I've dropped a few pounds basically. Yeah.
So
Yeah. So
to ask how you decide the surgery, but you said that you want to reduce your health, right?
yeah, basically, like if you see me, like, obviously not looking down over people, but compared to other people, like they are bigger than me. And I remember the other ladies I've met there as well, like they even like question me, like what am I doing there, because they were bigger than me. I told them, oh, I'm doing this because I've got like PCOS.
You want
So
yours.
yeah, exactly. Yeah, so that was like my main, like reason why I did it. Because normally I go to the gym, I play football, I eat healthy. But if you when you have PCOS, like it's just a bit annoying because you can eat small, but then your weight will like strike, and then like there's nothing you can do about it basically. Because my doctor, they'll tell me, they'll put me on like on a pill, but then that doesn't help as well. Or they will say like you have to go on a diet, and you keep going on a diet and nothing changes. Yeah.
So also I want to ask you, where did you find Clinichub? Why did you choose us?
Good. So I came across this girl. What's her name? She's called
Maybe
Debbie Elska, I think. Yeah, I came across a YouTube, and I was watching a video. I came across a Instagram page, and I saw that she obviously like announced to people. I think after a year that that's what she did, and she made like a whole like video about it. So I went on YouTube, I listened to her, and everything that she said about cleaning up, it was positive. Nothing negative at all. So I did my own research as well, and I realized that there was many people as well that have gone there and they had no issue. And
yeah.
we hear story of people going for surgery and they end up dying. But with cleaning up, I didn't see anything, so everything was positive. So I thought to myself, you know what, I'm gonna take my chance as well, because Debbie as well, she has PCOS as well. And then she obviously said that after the gastric sleeve, she lost weight, like PCOS, as the symptoms are getting like so much better. and then and she's happy now. She's able like to like control her food as well. So I thought, what, she's someone that relate with what I have as well. So it was only easier for me. So like I said, when I obviously and then she had a link as well that gave you, I think, 100% off as well. So when I click on it, I entered my detail and it went to cleaning up, and then someone obviously reached out to me as well to ask me more, like question about what type of surgery I would like. And from then, that's when I got assigned to my coordinator. And like I said, she was a lovely lady. Any time of the day that I'll message her, even if I speak to her now, 5 minutes, if I have like more question, I'll come. She was always open to answer my questions. Yeah.
Yeah, so glad to hear that. So, what do you think about our service, by the way? How many days did you stay in the hospital? How was the communication, transfer, or service, hospital service? Can you explain from the beginning, please?
Yeah, so obviously after I paid the deposit and my place was secure, I went ahead to book my flight ticket. Then I obviously shared it with my coordinator, and I think that detail was shared with another department from your side as well. And I remember a few weeks before I flew, someone messaged me as well from that side, to like they were nice at the beginning. They asked me, about my flight ticket and all that, so that they can arrange, like my transport from when I land to the hotel, and also when I leave as well. I think then a few days before I flew, someone messaged me as well to check up on me. They like gave me, like a leaflet as well that basically tells me when I land in Turkey, where I should go to wait, for a wait onto the right team as well. So exactly what I did when I landed, I left Manchester early in the morning and I landed in Turkey. Then I went right to that spot. I met a guy and I gave him my name. He went through the phone. It's like obviously saw my name, and I was waiting with other people as well. Yeah, and then once the taxi came, there was a lovely man as well who took me. I remember my internet wasn't working there, but the driver allowed me to use his Wi-Fi, which was very nice as well. Yeah, then from then we went to the hospital. The hospital is very, very lovely, very clean. Honestly, it's quiet. You have your peace of mind. Then when I got to the reception, all the nurses, they were very nice with me, very friendly as well. Then I did, my checkups, and I went into my room. My room was very, very like everything is just clean, honestly. A nice bed you've got like a sofa bed as well with a nice TV as well. Yeah, so to me, I had no issue whatsoever. I feel like the money I paid for it, what I spent on this surgery, everything was worth it. Yeah, so I had a good experience. Yeah.
Okay, that's great, really. So, did
Oh
you
yeah,
come?
sorry, I forgot. Yeah, so I landed on Tuesday. No, on Monday. My surgery was on a Tuesday, and I left on, I think I left on the 15th, which was a Thursday, if I remember. Yes. Yeah, yeah. And obviously before I left, they had to, like assess me to, just to ensure that I was fit to fly. But I had no issue whatsoever. I think the only issue I had was after the surgery. I remember going into the surgery, then I don't remember what happened because obviously they'll put me to sleep. But when I when I got back into the room, I remember they was trying to move me from I don't know how to call it. So I was moved from that thing into my bed, and the blood thing that was, where my stomach was removed, that was where the pain was, like was coming from. But yeah, but obviously then the nurses, they will come on time to make sure that they give you your drug as well to assess. So after a few days, everything was fine. Before, yeah, everything, I got nothing negative to say. Yeah, honestly.
Yeah, that's great, really. So, you did come alone, right? I remember that you were alone.
Yeah, my partner
Yeah.
couldn't come with me because he's in the army, and at that time he was working because it was just before Christmas. So yeah, I came by myself. I didn't tell my family member. The only person I told was my partner. Yeah,
Oh,
he wanted me to tell my family, but I said no because if I tell them, they will be scared. So I didn't want to stress anyone. Yeah.
So, did you feel alone in the hospital?
Do you know, I wouldn't say I felt alone because there was the language barrier as well. But at the time, if I, you know where the TV is? Yeah, when I've been there a few times and I met like some people as well. So we were using like the Google Translator as well to speak basically. Yeah, so most of the time I was literally in my room. Yeah, so I was fine. Yeah.
You have coordinators for language barrier, actually, but for the mornings.
Yes, was it Salma? Was her name Salma?
Alma.
Yes, Salma came. Yes, she speak English and French, I think Turkish, yeah. But her
Yeah.
and I were able to speak in French, and she would obviously translate it back here. But most of the time, the nurses as well, they speak a little bit of English. So yeah, so we didn't struggle to communicate. Yeah, everything was fine.
Okay. So, Clinichub also offers 2 years dietitian support for you. What do you think about dietitian service?
Um, you know what? You've been great to me. Yeah, you've been great. I think obviously before you got ill, I remember you got ill, but every week you would obviously message me to check up on me. Any issue that I have, you would obviously advise me. You would direct me to my to the book that I was given. Like I said, there is nothing negative to say, honestly. Nothing at all. Like I'm so pleased that I took that step and I've obviously met, a lovely team. And one thing I like is, after everything you guys still follow on with your client, which is good as well to know, because at the end of the day, it's not all about money as well. You guys care about, like, you care about the health of your patient, which is nice to yeah, to see.
Yeah, we are all here to support you always. Okay.
Yeah.
I want to talk about the diet a little bit. You
Mm-hmm.
pre-op diet, you told. Uh, so you were in contact with dietitian Eda in this process. So how
Correct.
pre-op diet for you? So that was hard, or
You mean the pre-op diet?
yeah,
Um,
liquid.
liquid. I don't think it was hard. I remember she sent me like a PDF, and obviously I didn't know whether I was gonna find those food in the UK, but she was able to find me, like some replacement basically. So I had Actimel, I had the jelly one, and what else did I have? And I think she said I could take a protein. So me, when it comes to healthy food, like I'm good at that. Like I said, like I play sport basically, so I know all that. So I didn't struggle at all. Yeah, I didn't. Everything was just like very clear to me. I knew what to do. If I like, I remember I went to the supermarket before I bought something. I took it like the nutrition picture, sent it to her, and she replied back to me. If it's not good, she would tell me it's not good, and she would literally tell me what else I can get on the spot. Yeah. So like I said, communication was very, very great. I had no issue whatsoever. Yeah.
I'm so glad to hear that. So what about the post-op diet? We do step-by-step diet plan after the operation to for your healing process actually, and we start with liquid diet, then soft food diet, and then solids. How was that for you?
The beginning of the post-op was hard only because, so I've got five siblings. We all born in December, and there was birthdays. When I came back, there was birthdays. So whilst they were eating good food, I couldn't eat good food. And like I said, I didn't tell them what I did. So everyone was like, why am I not eating? So I had to lie. Like, oh, I'm not feeling well. I'm not feeling well, basically. Yeah. So but um I knew that I couldn't eat as much as before, basically, and I had to be very, very patient with myself. I remember you telling me that I should make sure that whatever I eat, I need to like take my time, no rush at all. There are some times whereby I just wanted to eat everything, and I realized that when I do that, the food gets stuck here, and then I end up throwing up. Yeah, it has happened a couple of times, and I realized that, yeah, I'm not doing myself any good further if I continue like that, basically. Yeah. So weeks gone, I've obviously my mind adapted to it, and I realized that it's only fair if I follow what you say instead of following what I want to do. Because at the end of the day, um, the surgery is one part, but I'm the one that has to do the hard work now to make sure, and
Yeah.
yeah, to make sure that if I want this result, I have to do the right thing, basically. Yeah. So, like you said, 2 months now. I'm used to it. If I want to try something different, I'll go to the booklet that you refer me to, and yeah, I'm good. Right now, I can skip breakfast because I feel like I don't want to eat, or I can just drink my protein shake.
Mm-hmm.
And for dinner, I will obviously have either lean beef or chicken breast or salmon. And for dinner, I'll repeat the same thing again. If I want a snack, I'll just drink Actimel, basically. Yeah.
Okay.
So now I don't force myself. I listen to my body. Yeah.
Mm-hmm. Great. So in this process, we want you to lose weight with healthy way. So
Mm-hmm.
it's important to get enough nutrients in your body, especially proteins. Water consumption is very important to keep your body hydrated. So so you're like we don't want you to have any complication related to your nutrition.
Yeah.
So nutrition is very important after the.
Very. Mm-hmm.
So like 70-80% of your stomach is gone, you are gonna lose weight, but
Yeah.
we get enough nutrients during this process.
Yeah.
So I want to ask you, did you get any difficulties like nausea, vomiting, or pain after the operation?
The only pain I had was obviously when after I came out from the room. When I don't know how to call it, like the pouch. Yeah.
Yeah.
So I remember when I was on the bed, when I move as well, it obviously hurts. But I think the nurse was giving me my tablet, my medication. Everything was fine.
Oh,
When I came back to the UK, I was obviously taking my medication. I had no issues since I came back. My scars as well, like they've all dry up as well, and did not have any leakage at all whatsoever. Nausea was obviously when I try and eat fast. That's when the food gets stuck here, and I end up throwing back. But I've not vomited. I think in a good few weeks now. Yeah, because now I know better. Yeah,
yeah,
so my experience has been top. Honestly, yeah, I can't fault.
yeah. That's why we suggest you to have small portion. Uh, Solitude, truly, it's very important in this
Mm.
process. So you have lost like 10 kg in the first month. How do you feel about it? This
Um,
is very, very good weight loss for your BMI actually.
I feel good. Honestly, I wasn't expecting to lose that quick. The last time I was in my 70s was probably in 20 what 2015, 16. That was when I was probably finishing uni. Yeah. So now it's like maybe I don't see it, but when people see me, and when I wear my clothes as well, I can tell my clothes are now loose on me. Like when I go to work, there's a couple of times my colleagues have come or like, "Are you okay? Are you ill?" I said no. They were like, "Oh, like you've lost weight. Are you on a diet?" I said no, I'm okay. I'm just not eating. But yeah, I've not told anyone apart from close friend, but I'm grateful, honestly. Like I said, I'm all about like helping myself and have a good relationship with food. Because before the diet, I love food. Food, you know, yeah, food is good. So yeah, but now I've been given another chance to have a good relationship with food, for me to control my food portion and be in control of my health as well. So yeah, I don't know how much I'll lose when I get to 6 months, but I presume probably I'll lose some good ones. Yeah. Mm.
Yeah, weight loss may be quick in the first times and slow down later. It is very normal. Sorry. So this is important thing is continue regular weight loss, and in this process, it is also important to learn eat healthy eating habits.
Sorry, what was your question?
Oh, not
Oh, it's
question.
not a question. Okay, okay.
What is your target weight?
I want, so I'm 74. I'm coming out of the 70s. I think when I read, I think the healthiest weight for my age, because I'm 30 now, I want to be probably 55, but I want to keep my muscle. Like I said, I go to the gym, so I don't want to be skinny.
Mm-hmm.
I don't want to be slim. I want to be like skinny, but I want to still have like muscle mass, basically. Yeah. So my goal is to be 55, 60. Yeah, that's where I want to be, because I feel like if I lose any more than that, then I will shrink. Yeah, that's one thing I keep in mind.
When you reach your goal, you will tell me, and I am going to send you a maintaining diet plan to
Yeah.
maintain your weight. Okay.
Okay, that's fine. Yeah.
And proteins are very important to protect your muscle in this process. Okay.
Yeah, that's the one that I take. Yeah.
So, do you have any tips for the future patients?
I just feel like if you have the money, obviously you need to have the money. I just like if you have the money, if you're thinking of doing it, first of all, make your research. I spoke on my experiences, so please, I won't don't take my. But I had, like I said, um I did not had any issue with cleaning up. Everything that I went through was well done by lovely people. I did not had any issue with my surgery. I remember, and before my surgery, my doctor came to see me. Actually, he came before and he came afterward as well to see me, and I think that was good. Yeah, that one I really appreciated. Yeah, so thank him for. I think my doctor was Dr. Ahmed. Was it Dr. Ahmed? I think
Dr.
yeah, thank you. Yeah. So, yeah, like I said, guys, if you're thinking of doing it, think about your health, think about the future, basically. So please go ahead. Obviously, have the money for it. Have support as well. I think you can obviously go with someone as well, and just do it. Like I feel like it's a big change, a big change. Honestly, at the end of the day, we all have like health issue that we're battling with, health issue that are literally affecting like our weight, and sometimes you want to rely on doctor, and sometimes you just don't get anywhere. So just go for it. You only live once, honestly, so do what makes you happy, do what's good for your health, for your
Yeah,
body. Yeah, like be in charge of your life.
yeah, we can say if you want to change your life, like us.
Yeah, and I think I said that before I even made up my mind. When I was speaking to my coordinator. I asked her every question, and like I said, her answer literally kind of like gave me like that courage to go ahead, because I think she told me that she had done it too. Yeah, and her and I, we even like did a video call as well, and I knew that she wasn't lying to me. She was like a brilliant person, and and I got to realize that it's not about the money too, because you guys care about your people as well. So yeah, so do your research, do what makes you happy, and you won't regret it.
Yeah, that's great. So now let's look at the questions. Maybe, yeah. Is there any question I can see? But I think there's no question for you.
No, check.
Okay, do you want to add something?
Someone asked me which procedure did I have. So I had the gastric sleeve. So a gastric sleeve is whereby they will take out a portion of your stomach. I think probably 70 to 80%. Yeah, and you'll be left with a sleeve. So that's why I call it. It's called a gastric sleeve, basically. Yeah. So that means that you're not able to eat as much as you used to, and that's what kind of like help you lose weight. But at the end of the day, like I said, the surgery is one thing, and you only get good results obviously if you the person you end up following the right guideline that given, because it's very easy to relapse and end up putting the all the way back, because I've obviously done my research as well. So you as a person, you've got like a big job to do as well, in order for you to make sure that you hit your goal and you maintain everything.
Exactly. So
Um,
I think there is
Someone
a.
said, did I apply for a visa? No, I didn't, because I'm British. So my journey to Turkey was very easy. So yeah, so I did not have to apply to any visa.
So in total, you have lost maybe 14 kg.
I
Yes.
think so. Yeah, yeah.
Yeah, you have lost like 14 kg in 2 months.
In
Yes.
2 months, guys, and that is a lot. I that's a lot in 2 months. Yeah,
So
that's a lot.
much, by the way, like 33 maybe. According to your BMI, this is very high amount actually. This is very
Yeah,
good result.
because I did my research on Google, and I think in December I lost that, I think that 10 kg, and I remember I did my research and they were like, oh, that's way too high than what a person should lose in a month, basically.
Like 10.
Yeah. But at the end of the day, it's all down to me, because I've obviously been following my guideline. If I wasn't following the guideline and trying to eat, then I wouldn't have, been here. But one downfall is I go out with the friends. Like I went to Nando's on Monday at night time, and I ordered like grilled chicken with steam broccoli and mashed potato, and I had 4 servings and I was full. That was the main done. So that's the downfall to it. Like I said, you just not able to eat like you used to. So yeah, so be prepared. Be like you need to prepare yourself and your mind that it will take you a while for you to be able to eat a little bit more. And obviously, as as each month passes as well, you would be able to eat a bit more, than the previous month. Yeah. So it's just
Yeah,
a matter of time, basically.
day by day. So that's why you can eat more. But you have new stomach and new portion. You are learning your portions, right?
Correct. Yeah.
Uh,
Mm-hmm.
so what was your starting weight? It is 87.
Yeah, my starting weight was 87, and now I'm 74. Yeah.
Yeah.
2 months after my surgery, I'm now 74. So I'm not even like 6 months. So only God knows how much weight will I lose in 6 months time. What else?
I We can finish our live. I think we don't have any question. Okay, do you want to add anything?
No, I want to say thank you guys. And if anyone wants to ask me any questions, I can drop my Instagram username, and yeah, and take it from there basically. But I'm gonna say don't be afraid. And if you're thinking of doing something, go ahead and do it. Yeah.
Yeah, that's great. So glad to see you again, Stephanie. So I'm going to say bye to you. Happy to see you again.
No worries. Ibro, if I want to put my Instagram, where do I put it? I think.
No,
Oh, okay. Because it's. Oh,
maybe.
all right. Cool. All right.
How did you find?
I don't think it's allowing me to type though, but that's fine.
Okay.
Yeah.
Okay. Okay, I want to see you.
No worries. Thank you very much, guys. Appreciate your time.
Take care of yourself. Nice
Thank
to see
you. You too. Bye.
you. Bye bye.